belief there are two types of health, physical and the spiritual. You know, right now we've got a lot of churches all over, and they are also healing people. I believe, because I'm a pastor by profession, we are healing people. But now balancing the spiritual side and the physical side, I'm going to call Bishop Brian DeJuice to come on set and bring us balance between the spiritual health and the physical health. Thank you. Bishop, over to you.
Oh, thank you so much. Quite a very interesting one. I'm well known for blasting pastors, so you apologize. I apologize in advance.
Thank you.
I train pastors, so tendencies also, I've seen a lot of things that have happened. Let me say, the United Nations, I think it was around 2003, between 2005 or 2006, had to have a training for pastors. I think that time I was in Mutare, over 270 pastors were trained, because we had buried a lot of people from HIV and AIDS, coming from the place where people in church will go get prayed for, and then they're told you are healed. So go, stop taking medication. And now there was also a lot of stigma that was coming from the church, where people would preach all kinds of messages that stigmatize people who are HIV positive. And so the training helped a bit, but eventually it did not continue. But now, what I want you to say is, we've been training pastors, and we tell them the same thing. You are not the one that prescribed the medicine. You cannot be the one that takes somebody away from the medication. Wow. So if the doctor says you're taking this, it's the same doctor who should tell the patient, stop taking your BP medication. And not you as a pastor, because you're not a professional in that area. Same thing that I always encourage a lot of pastors. We have got a lot of pastors doing counseling who are not counselors. The fact that you are spiritual does not make you a counselor. You're not a professional. That's not your area. You're supposed to be praying for people, casting out demons, doing whatever you're doing. Stop counseling. If you want to do counseling, go for counseling training and be trained to do that. So I would say there has been a bit of more initiative now to push pastors from being in a place where they take the profession that is not theirs and make it everything spiritual, because not everything is spiritual. You know, a lot of people have got issues that are mental, psychological, but we're making them to become spiritual. Whilst we're supposed to just take somebody to a psychologist, take somebody to a counselor, and then they get helped there. And what I do is I preach the Bible, I teach them the word. Yes, I can pray for them, believe for healing, but let the doctor confirm, has they been healed? If they have not been healed, I always say doctors are not Satanists. They are not Satanists. They are co-workers with us. So if I can't heal you with my faith, the doctor can heal you with medication. Simple. So that way, we can then collaborate between the doctors and the spiritual world.
Wow.
Thank you.
This is insightful, Bishop. You know, I never took it from that angle. And most of us pastors, we always blast, for sure. We always blast the other side. But yeah, I think what is now the correct procedure? You are a bishop. Mm-hmm. What is now the correct procedure? If someone comes to you and say, I'm sick, mm-hmm. as a bishop, what advice would you give to say? Because I'm seeing most of the churches now, mm-hmm. They are moving towards the positive way, where they are having also the health practitioners in their counseling sessions, and or to confirm. Some churches are doing that, but that education is not much into many churches. So I'm with you right now. What is the best procedure? Which you would say, if someone comes to me and he says, I'm sick with this disease, what do you do?
The first and most important part, what I would encourage most churches to have, among us, the congregants, there is usually a medical doctor somewhere. There's usually a nurse somewhere. And one of the key things is let them be examined by a professional. What are you sick with? What is really the problem? Because like I was saying, some of the problems they are not spiritual. Some of those problems are actually It might be a bug. It might just be a virus. Yeah. So I'm not going to try to pray out a virus. I remember one pastor trying to pray out malaria. He said, "You spirit of malaria, out, out, out." And I was looking at him like, "Are you crazy? Are you okay?" You know. So the fact that there are people within your church who are health professionals, we have to have a health department within the church. Because we're a community, and we have to understand, I might be providing education, but at the same time, I might have people who are also health professionals. I remember somebody called me and says, "My daughter is not drinking milk. I don't know what's happening." I took a nurse and said, "Let's go." The nurse examined the baby, and we found out what the problem was. It was not even spiritual. So here you are trying to cast out demons and doing all that. So I will still call that, especially for the spiritual, for the churches, they must put together a health department within the church. It's very necessary.
Thank you, Ambassador.